Fairy. Thank you so much for joining me this week on Vet Ranch RoundUp. This is Kiki, and he is always shedding. I know, but he's worth it because he's purring in my ear. His brother Squeaky's down there too. They're up for adoption together. If this is your first time watching our videos and you don't know who these two are, definitely recommend you watch a couple playlists that we'll post. That way you can get caught up and see other cases that we've had that have already gotten homes and we don't have anymore. He's like, excuse me, keep petting me so I can shed all over your office. But anyway, I don't want to jinx it, but I think we kind of have like a pretty chill week this week of just getting caught up on stuff. But let's go check in. We have our little bun, maybe a couple spays and neuters, and just kind of some general wellness on everyone. So hopefully this week doesn't turn into a dumpster fire, which happens sometimes. But let's go. Are you ready? Kiki. His nails are digging into my shoulder out of pure joy. Yes, out of pure joy. Show everybody your biscuits. Yes. Let everybody hear your purrs. They want to come adopt you. I know. He's like, please continue petting me. Bubba. Is that good? We done? Why are cats the best? They're so therapeutic. Okay, let's go. So we were looking at Babble. We're trying to find a sleeping situation for her. We take off her thing for her to walk her brace because she, oh God, you got darted in the face. One, she has these little sores. They seem like they might be getting better. Thought maybe they were from being in a creek bed or laying on her side. And then she has a sore on her back foot. Where did it go? Now it looks better. Babble. And her little face. Look at her little face. Her little nose. That may be from trying to get out of her cage at night. So we're working on different sleepy spots for her. She slept in the break room last night. How'd she do?
Oh, I said she did fine. Everybody else was like, oh, she did bad.
She ate a bag of pretzels.
I didn't eat it. I didn't like that flavor.
Oh, she didn't like the dill pickle pretzels, but she made a little bit of a mess. So we're working on finding her the right place to stay. All right, let's see her walking. Slow it down, sister.
Come on.
Wow, looking good. Doing a lot better. Wow. We started walking Babble with a harness, and when she tries to pull forward, she's really trying to get away, so she's really digging in with that back foot. She's doing a lot better since using the brace and stretching and doing her physical therapy. Look at that. Good girl. She's so good. Dobby, he hears the other surgeries waking up. You didn't neuter today, buddy. It's like, I don't know about that. Dobby. I didn't even notice. What was blowing? All right, Dobby neuter. We'll get over to the vaccine store. Getting spayed today and her last vaccines, and then her adoption is going to be officially official. So big! She's grown so much.
Gosh, look at that rat's nest. Holy cow, how does get that on film, everybody? How did that even happen? As soon as the camera's rolling, we get knots in our stuff. Oh, everybody see what's up. You're on camera now, don't be. The world will probably not hear this, but you never know. You never know. Sometimes I wonder with these Vet Ranch videos if there's not some guy who can like get the audio even though we don't play it. You know what I mean? This one will probably be sped up. It'll be during one of our videos and it'll just be a sped up surgery.
Yeah.
Tell her bye.
Bye, baby. Bye, baby.
Bye, cute.
Aw, she's such a good girl.
Bye, Nola.
Bye, baby. Come on, let's get out of here. All right, these are Happy's x-rays. He has been coughing again after being weaned off the prednisone. So we started him back on a steroid, but we've ordered something special for him, a little inhaler. That way he has less circulating steroid throughout his body, and then it's putting him directly in his lungs. So we're hoping that'll help. They really don't look as bad as they did at the beginning, but definitely still some inflammation in there. So this is the Aero Dog inhaler, same as the Aero Cat, and it has these different attachments. This is not a commercial for it, although I guess it should be. And we're gonna do 1 meter dose twice a day, which is squishing it down so that it goes into the chamber. Then you're gonna let him breathe in a few times. So first, let's just see how he does with that. He kind of gets a little grumpy. You wanna try it? Happy. It's okay. It's okay. So it's okay. Look at you. So brave. He's licking it. Sweet. There you go. So brave. Oh, we're gonna just smell. Trial and error. Good boy. Hey, not. It's okay. Maybe what we could do is put a little bit of peanut butter in there so he can because he's currently doing that anyway. Good boy. And we'll do that twice a day for now. And then it tells you how many doses are left on there. So each pump is a dose. Cool. Spay today. It's finally time. We did not get to do a nice multimodal. Oh God, she's awake.
She's rearing her head.
Oh my gosh, she's rearing her head. She's so hard to handle. We have attempted this several times, but we don't want to traumatize her or us. Any handling, she tries to bite because of her past. We had to give her just an IM injection to slow her way down after giving her oral meds this morning to slow her somewhat down. And here's where we're at. She's happy, but I'll still bite you if I get scared because I think you're gonna hurt me, baby girl. Ugh. We're trying to figure out who is
Getting their exercise,
getting
their cardio.
Yeah, getting their cardio in this morning. I saw the calico kind of fly up the other side. Can I help you? Yeah, let me out. Oh. I try to show the other one. They're like, no, look at me. It's already time for their vaccines again. These little troublemakers. Just growing up. Yeah. Then we'll get them spayed and neutered and hopefully get them in Petco or get them adopted into homes. Kitties. I know. Holly, skin looking a lot better. Still getting medicated baths. We're hoping to spay her next week and do a dental. We just wanted to try to get that cleared up as much as we could. She's a good girl. La la. She looks like a Muppet. Go get it, bro. Go get her. No, she's the enemy now.
Don't you look emo?
Yeah, especially with that jean jacket.
All I want is emo girl.
Well, look what Ryan dragged in. This is what Ryan told me. Ryan said, hey, you can take this cat or it can go to the shelter. Ryan knows what's gonna happen. Rude. So we got this girl in. You think she could be pregnant?
We're expecting.
She expects a baby shower. She was hanging out outside the apartments and about to have her second sip. She's been eating watermelon seeds. One guy told me that one time when I was pregnant. Gross. Okay, let's take some x-rays and see how many. Oh, I just felt one kicking in for real. She's a good girl. Here are her x-rays, and I decided to name her Lunchable because that is an awesome name. And then we're gonna figure out names for the babies when they're born. But I am not gonna count these. I'm gonna just highlight a few of them, and I wanna see in the comments how many kittens you guys think that she's gonna have. And then we'll see who's right. I'll post a picture too. Ooh, that's a lot. And we were just looking and seeing, look at her stomach is squished up here with her liver. Her little tiny kidney is pushed all the way up to her back. Her intestines are squeezed in. So Mama is over it and ready, I'm sure. Here's this girl's setup. April got real extra with it. Little curtain, little box, ready for the babies. Every single day, this little friend is braver and stronger. Hey, Kikiti. Look how good you're doing. Yeah, hi. Kikiti.
Here we have Noun here, our little kitty that was found on the side of the road. Everything's looking pretty good up front as far as the little injuries and road rash and tar that we had on there. However, one thing that we're just now starting to notice is actually the end of this tail and the injury that has occurred here. We were really hoping the medications that we were using for the face issues and the other areas would take care of this tail, but unfortunately it has not. And so what we're gonna do today is amputate this tail just above where we think the dead tissue has occurred, because now cannot feel the end of this tail. I think there's actually some bone exposure. So what we're gonna do is probably amputate about here to remove that source of pain, and not really infection because of the meds we've been on, but mostly pain. And so we can get this kitty pain-free life. We are here with Noun for the tail amputation. It appears that everywhere from here down is necrotic tissue with no pain sensation or no feeling at all. And so what we're gonna do is amputate this tail higher than that. And often with injuries like this, sometimes things will continue to die and we just can't tell what's good tissue, what's bad tissue. So in this case, we're going to go a little higher here. And what I like to do is make a few little V incisions on the side, because incision tends to come together a lot better when I do that. Cut through there, through that skin. And then what I like to do is, once I have my initial incision, I'll walk my scalpel blade up, because I want some skin overlap, and then I'll find, just like that, where that vertebral space is. And then once I just push through that vertebral space, and certainly in a cat this age, everything's pretty easy, then we can cut that tail off through the vertebrae space, as opposed to through midway through a vertebrae, because I don't think that would be kind. Now, a lot of these tails, every tail, has vessels on both sides. And so what we'll do is I'll ligate both of those, and then because of this V here, we'll close this tail, and that'll make a little rounded end. So let me see what we can do here. And try to just ligate those vessels. I think we got one side done. We'll get our other side. We'll see if that's a good grab there. So still a little oozing, it looks like, from underneath the tail, just some little vessels. But we'll take some big grabs for the skin incision here, and that pressure should stop that. My goodness, this dude's skin is so thin. And what I generally like to do with these is actually, whether it's a dog or a cat, I prefer to do the corners first. That way I can see what's left. And this little kitty, tail is so small anyways, I don't think there's going to be a whole lot left. I just want to make sure I do a good job here. I think I could have gone with a little smaller suture for this guy. Kind of regretting that a little bit. And a little granny knot there too. That's alright, we fixed it. So we've got our corners done, and I'm going to just put a simple suture right there in the middle for good measure. I think that would be enough, but what we don't want to do is not enough. I would much rather remove more sutures later than have to come back and sedate this little guy and close a hole that comes open because I didn't do my job good enough the first time. Excellent. Not the prettiest tail right now. Very, very happy with that though. No bleeding, no oozing, no dead tissue. So hopefully we've removed a source of infection, pain, and this little guy will do really well.
Okay, so we have first vaccines, but also just checking from surgery. Look how cute this looks. This little tail. This is a little bobble tail. He's leukemia FIV negative. These little scars and stuff, but they're getting better. And we want to go ahead and try him with Verb and...
Oh boy.
The Verb gonna get you. Verb's a lot.
You might give Verb a run for his money.
No, you
He's
think?
crazy, yeah.
You're pretty wild. I hope so.
It's crazy. Where are you giving that vaccine exactly?
It's for cardiac, I guess, or spinal tap. Poor guy.
That's a long needle.
So when do we think
You would have
we can
failed
let
the
them
test,
eat?
just FYI. You would have failed the test.
Me?
That's not the needle that you put on for a vaccine. That's one of the questions.
Me?
Me.
Oh yeah. Okay. We're done.
Didn't even care.
Should we see? Maybe we should just put Verb with him for a minute in his area and see how that goes, because that's going to be the real, the real doozy.
Wake up, wake up, wake up.
It's a wildcat. Get that Gumby. You want a friend?
Verb. Hey man, what's up?
What you got going on up here? So are they treating you about the same as they do me? It's like you have a box, we have a plaything in ours, so it's a little better. Get it?
So it's a little better.
Yeah, it's a little better than this. Noun. This is Verb. See? We pre-planned this. It's so funny because I feel like last week, even though it wasn't, that was Verb wanting to have a friend.
Yeah.
Now he's too cool for school.
Like Dee Dee was for him.
Yeah, he's just too cool. He's getting all your stuff.
That's cute. Oh.
We're gonna see how Babble does in the. He loves it. He has a friend. He's so happy.
Just throw him in with all of them.
I don't know. Oh, she just bites and holds it. It's like, would you just pay attention to me? You're just refusing to acknowledge that he's even. You're a little eager, bud. All right, let's put them together down there and see how they do. Maybe someone will care about you now.
Click, click.
Will they even notice that there's another one in there?
Probably
Or-
not.
So you have a tail. Think you're fancy? Dee Dee just stopped growing.
I said somebody's paying me attention.
Oh, that's rude. Just bite your new friend. So we'll do tomorrow as like a long play day together and see how they do. I don't want to start them overnight.
Yeah.
Because what if it gets beat up? It's pretty annoying. Ultrasound day for Ricky Bobby. He looks pumped. Gotta treat your heartworms, bud. He doesn't look totally comfortable yet.
Yeah, he's trying to figure it out.
Get comfy, Ricky. This is called a dog hammock. Here are Ricky Bobby's chest x-rays, and they don't look great. So this is a really enlarged heart. Uh-oh, he saw me. Sorry, dude. I'm just telling people about your heart. It's a really enlarged heart, a lot of venous congestion, definitely bronchitis or inflammatory pattern in the lungs. So we are going to start him on sildenafil for pulmonary hypertension, so high blood pressure to the lungs, and Plavix, an anticoagulant, and he's been on doxycycline. So we're going to do those things for a little bit before we get started with this heartworm treatment. Luckily, he just had a few worms in there, so he does not really need to have any extracted or anything before treatment. So anyway, kind of not what I was hoping, but definitely not unexpected. Did you hear that cat, Ricky? Here's the other view of Ricky laying on his back, and he's got that classic reverse D appearance, big right atrium, so poor guy.
April thinks he wants to be a lap dog, held like a baby.
Oh,
It's
it's a
just a baby. Just a baby.
Oh, good.
That's what, I mean, if we're gonna do that pose, it's gotta be with a dog named Scar. It's a shepherd.
What's Scar?
Scar, look up. Can you cross your legs, please? Okay, all right. We're here with Scar today. He has had a little issues with his ears. We actually already did a cytology, and that's where we take a sample of the ear and look at it underneath a microscope, and we saw some bacteria and yeast, and so we're gonna address that infection. But I just wanna make sure there's no foreign bodies or anything else in there, which I do not see. Scar is such an awesome shepherd, isn't he?
Yeah, he's
Scar. You know who else is an awesome shepherd? Stallone. Okay, so we neutered Scar the other day, and actually some students were here, and so we did some external sutures on his neuter site. So we're going to remove those sutures as well today. Yeah, let's do it. Everybody, easy, my man. Good. And he just has a few sutures that we'll get out of here. One. How is he so good? Two. Arms out, buddy. 3, 4, 5, 6. That's it. We did it.
Good boy.
We did it.
Good boy. Good boy.
T-Bone's little area X-Pin that I got him. He's exploring it. Hey, buddy. He is the nicest rabbit. What do you think? It's making my head hurt looking at that. So cute. Well, I'm not as exasperated at the end of this week because it wasn't as crazy. No new intakes. I don't know why I'm saying that out loud because something crazy is going to happen. But we won't be here next week. We're going on a family summer vacay, so we'll miss you guys, but we'll be back the week after that. Crimson has an adoption application. I don't even know what to do with that information because we had him up for adoption just in case the right home came along with no other cats or FIV positive cats, and we're not expecting to get an application ever. So I'm gonna call them in a minute. That's kind of weird. But anyway, thank you guys so much for all your support. Thanks for watching our videos. Consider subscribing and turn on notifications. If you donate to Abandoned Pet Project, you are my lifeblood. Okay, that was really dramatic, but you kind of are, and you are the reason that we can do what we do, and you give animals a real shot at living a happily ever after. So thank you guys so much, and I will see you the week after next.